Personal care homes have been ignored for a long time, and now the spotlight has been shed and all the skeletons are out of the closet.
A woman who knows firsthand what it's like to have a mother living in a personal care home in Manitoba right now is speaking out about staff shortages and outbreaks and why it's propelled her to form an advocacy group to help give a voice to those who desperately need it. Lisa Streifler has a 90-year-old mother who currently lives here at the Simkin Center in Winnipeg. She says her heart goes out to Simkin staff who work inside the care home, as she knows they are trying their absolute best to care for people during the pandemic. She says her frustration lies within the government, and she's appalled at the lack of support for personal care homes. She's hoping, along with 6 other women who have parents living at Simkin that are now a part of her advocacy group, the change is on the way when it comes to the way staff are tested.
You know, right now, our main issue is on rapid on-site testing, because we've realized that this virus is being spread in personal care homes by staff.
Ontario's premier announced Tuesday his government has started deploying rapid COVID-19 tests to long-term care homes capable of giving a test result in minutes instead of days. When asked whether or not rapid testing is on the way to Manitoba, our province's top doctor says they are working on a similar strategy.
Rapid test availability is just emerging now, and so we are working on a plan that would involve testing in long-term care facilities. So we don't have a finalized plan, but there'll be more to come on that.
Lori Kirketti, CEO at the Simkin Center, says rapid testing of asymptomatic staff would be incredibly helpful in slowing COVID spread, adding that her staff are currently ready and able to do the testing if given the ability.
Absolutely, we would like something like that. Absolutely, I believe it would be beneficial.
In the meantime, Streifler says she has noticed her mother declining physically and emotionally since the pandemic began, and the staffing shortages are being felt most by those in need of care, isolated inside the homes.
It's heartbreaking to see people sitting in their room alone for hours, ringing the call bell, and no one comes.
In Winnipeg, Mark Neufeld, City News.